Can you tell me a little bit about some of the barriers that you run into with your patients?
I had interesting barriers here. The most common I found is the language barrier. We do make great efforts in trying to have interpreters and having these iPads for those interactions that we cannot have an in-person interpreter. But I feel like even though it's a little more challenging because of the time, right? When you have an interpreter and you have to use another person to chime in to what you're saying, it's a little more challenging to like be as thorough as you can because you're short in time as well. So those are the things that I have noted as well. Personally, I have noted a lot of patients come already biased by their experiences, either personal experiences or family history of diabetes. And most of the case, like the parents had diabetes, let's say in the 70s or 80s. And most of the patients come in talking like, oh, I don't want insulin because like I know my mom had insulin and she died, or my father had insulin and he ended up in dialysis. So I don't want any of that because that's what's going to cause me to go through the same thing. And in order for us to try to diminish that and those misconceptions, we do have to have a heavy educational component to it, right? And a 20-minute visit and sometimes even a 40-minute visit is not enough for us to do that.